Hi, I'm Erin with Body of Light Studio, and today we're going to take a look at the anatomy of some of our back muscles and our scapula. We're going to do side body stretching to alleviate low back pain. So take a look at this guide. This is Cunningham's book of anatomy, textbook of anatomy. It's a really old, vintage anatomy book, one of my favorites. It's so beautiful. And you'll see here we have the latissimus dorsi, the longest back muscle. And I just want you to notice the connection to the glutes. So the glutes, they go down and out. The lats go up and out, and they all attach to this diamond shape band of fascia. All right, so we're gonna look at the lat in this book, and you can see more specifically where it inserts onto the humerus and where it attaches to the spine, and then again that broad aponeurosis diamond-shaped tissue. And then let's look at the scapula. So here's the scapula. This would be the lateral border of the scapula alongside the armpit, the vertebral border of the scapula alongside the spine, and then you've got the socket, the glenoid fossa. So let's take a look at our skeleton here, and you'll be able to see his very big scapula. So we've got the lateral borders alongside the armpits, the vertebral borders alongside the spine, and then the sockets of the scapula are right on the side of the body. That's where the humeral head fits in to the scapula. All right, we're gonna go to the wall and stretch our lats. So here we are up against the wall. I've got my right foot all the way up against the wall, hip and shoulder, and you're gonna reach your right arm forward. You're gonna suction your humeral head into its socket. And as you sweep the arm up the wall, you're only gonna go back as far as you can go without feeling pain. But as you bring the arm up, the vertebral border of your scapula glides down. And from the inferior angle, the lateral border of the scapula glides up into the arm. And then you'll flip your palm to face the wall. Now, ultimately, you want the arm in line with your ear, but again, you only go as high. Maybe your arm is down here because you're only going as high as you can go, keeping the vertebral border of the scapula gliding down and the lateral border of the scapula gliding up. And then you're gonna try to flatten the space, or actually make no space, flatten your body, take the space out from between you and the wall. So you're a little lopsided here, and that's okay. We're stretching the right side of your body, and you're getting really long through the rib cage. And just check in with your lumbar spine. Notice what's going on. Are you allowing the abdominal organs to spill forward? You want to take the sides of the sacrum down, the tailbone down, and lift the top of the sacrum up. Lift the fronts of the vertebra up. And you're gonna breathe, and you wanna imagine that you have these fish gills along the sides of your rib cage, and you're inhaling through your fish gills directly into your lungs. So you're gonna breathe in through your fish gills, fill the right side of your chest, fill your right armpit, and as you exhale out of your fish gills, maybe you can crawl the hand a little higher up the wall. Again, vertebral border of the scapula going down, lateral border of the scapula reaching up into the socket, up into the arm bone. Let's take one more breath, maybe crawl a little bit higher. And then you'll flip your palm to face the center of your room, away from the wall. Bring your arm down, and we'll turn around and do the other side. So before we do the other side, just take a moment to stand, sense your feet on the ground, and feel the difference between the two sides. You might actually be longer and taller through the side you just stretched. And then you'll place your left foot on the wall, hip on the wall, reach your left arm forward. Widen across the space between the scapula. Suction the humeral head back, and then slowly start to bring the arm up. The vertebral border of the scapula goes down. The lateral border of the scapula goes up into the socket, into the humerus. And then you turn your palm to face the wall. You might be able to crawl the hand a little bit higher up. And you'll place your mind's eye right along the side of your left rib cage, imagining that you have fish gills that you could directly intake air through, directly into your left lung. We'll do 3 or 4 really nice deep breaths here. You're going to inhale through your fish gills, feel your left rib cage spread wide into the wall. And then exhale out of your fish gills, crawl the hand a little bit higher. Tail going down, sides of the sacrum going down, top of the sacrum going up, crown of the head going up. Your abdominal viscera, your organs are lifting up into the spine. Let's take another inhale here, crawling the hand a little taller, and exhale. And then to come out of it, you flip your palm to face the center of your space, away from the wall. Slide your hand down and step your feet together. And feel the sense of width across your chest, across the shoulder girdle, the sense of lift along the sides of the ribs. And let's do one more stretch for your side body. We'll go lie down in a nice open floor space. And you're gonna lie down on your right side. We're gonna do Anantasana, one of my favorite yoga poses, reclining Vishnu. Let's see if I can scoot back a little farther so you can see my feet. All right, so for this one, your hand is on your head and your fingers are pointing straight up to the ceiling. So I like to check with my top hand to make sure that the fingers are actually pointing straight up. And you're just cupping the base of your ear bone, your temporal bone, and a little bit your occipital bone, the bottom back of your skull, but mostly your hands on the side. So your pinky is right behind your ear, and your right hand is cupping the right side of your head. And it gives you a very specific drishti, or gaze. So you're going to keep your eyes focused off in that direction. Your top hand can be in front of you for support if you feel like you're going to fall, or your top hand can be long alongside the left side of your body. Your legs are stacked and you're lined up from your heels to your hips to your shoulders to the center of your skull. You can actually do this up against a wall so that you know that your feet and your pelvis, your heart and your head are all in one straight line. And then we're really stretching again the right side of the body. You're trying to take all of the negative space out from underneath your armpit. So after I've been here for a little bit, I'll crawl my right elbow a little bit farther out. So the right side of the neck, it's a pretty deep stretch for these upper trapezius muscles, some of the muscles along the side of the neck. But it's a release for the left side of the neck. It's a stretch for the right back muscles, the latissimus dorsi, and it's a release for the left side. So you're lengthening the right side of the body and you're softening in the left side of the body. Again, you're placing your breath in your right lung. You're breathing in through your imaginary fish gills along the right side of your rib cage. And then you'll lengthen your bottom arm. Right, so we'll roll over onto your left side. I'm going to do this facing backwards so that you can see maybe a little bit better the positioning of the hand. So again, you're cupping the temporal bone, the ear bone, and the occipital bone at the base of the skull, all 10 fingers pointing straight up to the ceiling. And you lengthen your left elbow, trying to take out the space from underneath your left armpit. You want to be really flat against the floor here. Gazing off in the direction that's dictated by the positioning of your hand. And with this left scapula, the vertebral border of the scapula is gliding down into the inferior angle. And from the inferior angle, the lateral border of the scapula is gliding up into the arm bone. So the glenoid fossa is reaching up and out through the elbow. The elbow is lengthening away from the shoulder. Check to see that your feet and your pelvis, shoulders, and skull are all in one straight line. Again, you could do this up against a wall. And you're going to enjoy the stretch along the left side of the neck. You're getting a little bit of sternocleidomastoid stretch here on the left side, and the release of the musculature along the right side of the neck. The release of the right waist, collapsing in. The right leg is actually even a little bit shorter than the left leg here. You're pressing out through the left heel. Breathing in and out of your imaginary fish gills. And then you'll gently lengthen your left arm and lie down on your back. You can have your knees bent with your feet standing or your legs straight out on the ground. And just take a moment here. Let your head rock side to side. And then let your head rest in center. And feel your back body release down into the ground. The tail, the sacrum, the lumbar spine. Breathing wide across your back ribs. And place one hand on your belly, one hand on your heart. Feeling the breath rise and fall, the heart rise and fall with the breath. And you can lengthen your right arm alongside your ear, roll over to your right side, press yourself up to sit. And sit symmetrically for just a moment, whether you're kneeling or sitting in a chair. Rest your hands in your lap. Close your eyes. Feel the length along the sides of the neck, the width of the shoulder girdle, and the lift of your rib cage. You can slide your eyes open. And that's it for today. Thanks for joining. See you again soon. Bye.